Hi, this video is for those studying for COMLEX Level 2 and 3. I just finished taking the exam and figured I'd share some actual test concepts. I'll tell you exactly what you need to know without wasting your time. Let's get to it. A 2-year-old boy presents with bruising and various stages of healing in the upper extremities and abdomen. The mother says that the patient is very much a tomboy and is always getting into things. The father is a physician and the mother is a nurse. The remainder of the exam is unremarkable. Which of the following is most appropriate? Take a moment, pick your choice. All right. Bruising in various stages always is non-accidental trauma, and that's child abuse on COMLEX. They're giving you the answer. So let's work backwards. Choice D and E are wrong. Ordering lab work, hematology, physical exam, all of those things are appropriate, reasonable, but wrong. You need to know there is no required component on a physical exam, no required lab work, no required skeletal survey, no imaging. Nothing is required when addressing physical abuse. The only thing that is required in order to report physical abuse is suspicion. Choice C, wrong. Arranging a meeting with the parents is incorrect. Generally, when you're taking the COMLEX, you should avoid answers that ask you to confront your patient. So that would also apply to questions that involve a patient who is malingering. In this case, the answer is wrong because it could endanger the child or interfere with a potential investigation. Choice B, incorrect. The ethics agency isn't a mandated reporting body. It's wrong. Choice A, correct answer. So I know it's a bad answer, but I think that's what makes it a very good COMLEX answer. All your test bank questions are going to be really easy, no-brainers, and then on test day, you're going to get an off-the-wall question with suboptimal answers. So obviously, the most appropriate agency would be CPS, Child Protective Services, or Adult Protective Services. But calling the police is a mandate. That would be the most appropriate step in this case. Usually it's reserved for imminent danger, but they're a mandated reporting body. And the point of this question is that you need to report child abuse, no matter how instinctively odd it feels. So just as an aside, elderly abuse, it's usually going to involve a patient pleading not to have their situation reported. They're maybe even expressing that they don't want to go to a long-term care facility. Don't fall for it. It has to be reported. When we say elderly, that means a 60-year-old, or it could be any adult that has physical and mental impairment, and that would be vulnerable adult status. They have to be reported to Adult Protective Services too. So don't fall for the distractors. And that's it. I hope this is helpful. Good luck studying, and thanks for watching.